one that we felt encompassed Chapter 3 as a whole was Weight Watchers. It is an interesting and often overlooked perspective of the integration of electronic and online health services. I have found through my interactions with others that Weight Watchers offers 24/7 expert chat as well as one-on-one phone or email sessions with a personal coach. These phone services, similar to NHS Direct and NHS 111, which will be discussed later on, offer convenient information about diet plans, exercise plans, and nutrition. Since the 80s, efforts to enhance public health information access in order to promote informed patients has taken place via kiosks with keyboards, touchscreens, and telephone services. One of the most prominent efforts was the United Kingdom's NHS Direct, a 24-hour telephone helpline staffed by nurses to provide credible, accurate, and efficient information to the public. With intentions to encourage self-care, it began as an effort to give health advice, information, referrals to other health services, and later a sort of out-of-hours care. Although it had a high customer satisfaction, it felt to decrease need for other health services and was underused by older people, ethnic minorities, and other groups. Recently, in 2014, NHS Direct was replaced by a new service called NHS 111, with hopes to fix malfunctionings with the previous service. Fewer than 10% of primary care trusts were using NHS Direct because of high costs for services, and general practitioners expressed their dislike for the phone service because of its high referral rate of 1 in 4 to a general practitioner, thus increasing their workload.
In early 2014, Memorial Hermann launched Nurse Healthline. It is a 24/7 helpline staffed with bilingual nurses who are available to the public free of charge, regardless of health coverage or medical affiliation, meaning you don't have to be a Memorial Hermann patient to call. Just like NHS Direct, this helpline is designed to help patients better assess their medical needs. By helping the patient analyze their situation, they can direct a patient to the correct outlet of help, being an emergency room, a walk-in clinic, or even providing a solution over the phone, therefore saving the patient both time and money. While I wasn't aware of the Nurse Healthline in Harris County prior to this project, I was, however, aware of a similar helpline offered by Blue Cross Blue Shield of Texas. It is a 24/7 nurse-staffed helpline that my sister has used on occasion and has always reminded me to use if I ever come across a problem while babysitting my nephews and I cannot get a hold of their pediatrician. The drawback to this service, like the book stated, is that the people who used these services were the same ones who used other health services, which I find true especially in the case of my sister. My sister is always thinking ahead when it comes to my nephew's health. She needs to know that she can get a hold of someone who can talk her through instructions. She knows that going to the emergency room for a temperature of X degrees will cost an arm and a leg. Therefore, if there is a way to get reassurance without visiting the hospital, services such as these will come in handy. However, most who tend to make last-minute anxious hospital visits do not know these helpline services are available. These helpline services need to campaign their services to people of all socioeconomic backgrounds.
Moving on to computer-mediated health materials, these interactive sources show that compared to print and video, interactivity is more engaging and provides stronger desired effects. An excellent example of interactive computer-mediated health materials is CHESS, the Comprehensive Health Enhancement Support System. With origins in 1989, the CHESS system is still evolving and developing to this date. CHESS is a system accessed through the internet or software designed to help people cope with health crises and medical concerns. It is information, social support, decision-making, and problem-solving tools all in one system that personalizes your information depending on behaviors, prompting change if it's harmful to well-being. Recently, accolades have been given to CHESS for their smartphone app, A-Chess. The app serves to help patients with alcohol use disorder prevent risky drinking and features audio-guided relaxation and alerts if patients are near a high-risk location, such as a bar they used to frequent. Compared to patients who receive usual care after treatment, HS users had fewer risky drinking days and were more likely to remain abstinent from alcohol.
From those around me with experience with the Weight Watchers app, they have found it to be a helpful tool that keeps track of their caloric intake. Based on your height-weight ratio, you are given a certain caloric limit that is converted into food points to be used throughout the day. For example, a tablespoon of Land O'Lakes butter spread is considered 3 points. Those 3 points are deducted from your daily allotted points. The app can also check restaurant menus and assign a point value to it. Through the app, a Taco Bell Chicken Chalupa Supreme is worth 8 points. Points can also be awarded back through physical activity such as running on the treadmill.
With present-day access to the internet, there is a myriad of health information that can be reached in an instant. However, it is generalized to the overall public and isn't considered a secure source for diagnosis, such as WebMD. Although a great source for gaining additional information for an already diagnosed illness, receiving a diagnosis through an online basis can be problematic. Many diseases have similar symptoms, making generalized information insufficient. Although email or video interaction can alleviate the problem, without hands-on application, proper diagnoses cannot be made unless the patient has proper equipment and knowledge how to work it, all of which can be more troublesome than visiting a clinic for a face-to-face diagnosis. Despite this opinion, online health information found through social media is affecting healthcare in many ways. More than 40% of consumers say that social media affects how they deal with their health. 90% of respondents from ages 18 to 24 stated that they would trust medical information shared by others through social media. 41% of people said that social media would affect their choice of doctor, hospital, or medical facility. YouTube traffic to hospital sites has increased 119% year over year. Lastly, out of online health resources, WebMD was used 56% of the time to search for health-related information. Although a bit wary that we put so much use into online health information, the text states that this information is used as a source of empowerment for patients and can help create better interactions with their primary care providers. Despite speculations, online and full consultations for a diagnosis can be a crucial part to populations which are distanced and heavily rely on telemedicine, such as Alaska. In cases such as these, common ailments have the potential to be assessed through these means where face-to-face diagnosis is not possible. Besides online health information, emotional support is often an important part towards regaining health. As a great substitute for those who live in distant areas, want to maintain anonymity, or simply too busy to partake in face-to-face meetings, online support groups, otherwise known as mutual aid groups, have been and still are beneficial health sources. As Chapter 3 states, online patient helpers do not have professional medical knowledge, but provide unique insights as fellow sufferers and can identify more accurately than health professionals ever could. In a study for women experiencing postpartum depression, online group support served as an important source of encouragement for seeking a physician's help, seek treatment, and taking prescribed medications. Interestingly, instead of women aiding one another with other websites, books, and similar educational sources, the women mostly shared personal accounts about how to deal and normalize their postpartum depression. One of the things Weight Watchers is most known for is their meetings. In these meetings, members come together to assess their progress and offer both emotional and physical support. With the years, Weight Watchers has evolved to include online support. Both in-person and online support encourage the patient to continue their journey. Challenges are posted to keep everyone maintained with their health goals. Recipes for healthy eating are posted and swapped. Motivational blogs and discussion boards are updated and followed to keep motivation up. And helpful tips and fitness factoids are posted throughout, all set in place to help reach goals. Patients helping patients to achieve one common goal, a healthier lifestyle. As Chapter 3 stated, more people are using the internet as a source for medical information. As this trend is increasing, American doctors have indicated that their patients talk to them more about health information they have found on the internet and ask for recommendations about the best websites to visit. More patients are becoming empowered and more knowledgeable about their health status. Along with this empowerment comes the want for easy access to their doctors. Email, for example, is something that some doctors are starting to utilize. The convenience of being able to ask your healthcare provider a simple question about your health rather than making a full appointment can come in handy for most on-the-go patients. On the other hand, some doctors fear that utilization of email will only create a bigger workload for them, since they will have to make time from their schedule to answer emails, which also leaves a question of payment. If it is not a full consultation that is billable to the insurance, who will pay them for their time? Is it something that can be billed? Another downfall of the internet-savvy patient that doctors fear is the patient who may not like the diagnosis given by the doctor and will take to heart the recommendations of a non-accredited website. Perhaps one of the newer things that Weight Watcher has started to advertise is Personal Health Coach. This service is available for members who want one-on-one personal service. A trained professional is available via email, phone, and text for convenience and added support. Each trained professional is a person who has gone through the program, so they too know the struggles that the client has. Although our Weight Watchers example carried a lighter tone, all of these services are available and can be further implemented for more serious conditions, such as the use of e-health and telemedicine in rural areas of Alaska. Local clinicians are able to integrate all these services to provide better medical attention to those who cannot access it. In a recent article published by the Washington Post, 2015 was regarded as the year of India's next technological revolution, health apps and devices being a main contributor. Innovator Kanav Kaul added inexpensive sensors to a tablet and created the Swasthya Slate, a health device with 33 sensors for blood pressure, blood sugar, heart rate, blood hemoglobin, urine protein, and diseases such as HIV, syphilis, dengue, and malaria. After testing, this device proved to be as accurate as medical equipment in Western hospitals. In a trial conducted by the Indian government in March 2014, the device proved to be successful for the 2.5 million population in the states of Jammu and Kashmir. What used to take about 14 days to complete because of travel from clinic to clinic for different diagnostic tests, antenatal testing for pregnant mothers was reduced to 45 minutes in a single clinic. The time healthcare workers used on paperwork, recording data, and filling forms was reduced from 54% to 8% of their workday. Thousands of people gained access to medical care that had previously been unavailable to them because of their locations and lack of doctors. With devices such as the Swasthya Slate, the diversity of health and medicine applications can now be used to bridge any socioeconomic gaps affecting our world.
Some